So you want to know, why do you need prescriptions for medications? Well, in this video, you're going to learn all about the business of prescriptions for routine medications, labs, and imaging tests. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health, so you can be informed and in control of your medical needs. If this is your first time on the channel and you like to get fact-based healthcare information, please hit the subscribe button for me. By the way, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. Okay, so let's get into it and start sorting fact from fiction. So what's a doctor's prescription? What's it for? And why is it still needed? So the whole history and the business of doctors' prescriptions is quite interesting, but in need of urgent revision, as we will discover by examining a number of issues. A doctor's prescription is typically needed for most medications, including generic medications. It's a legal document, it's patient-specific, and lists the patient's name, date of birth, and the date the prescription was written. It authorizes the pharmacist to provide the drug for which the prescription is written. It includes medication details in terms of dosage, frequency of administration, and the number of pills to be supplied. As well, it contains a doctor's signature and specifies if refills are allowed. Prescriptions are also commonly required for routine lab and imaging tests, but the reasons for this are a little hazy. So what's the history behind medical prescriptions? So the history of medical prescriptions is interesting. It goes back about 2,500 years BC. Of course, at that time they weren't for the sort of medications we use today, but more for ointments, salves, and so on. The first drugstore appeared in about the 8th century, and the RX sign for recipe became the standard symbol for a prescription in medieval times. Later, the roles of pharmacist and physician became separated. At one time, pharmacists were also doing treatments. And in 1951, regulations were enacted to define which drugs could only be obtained through a doctor's prescription. Currently, e-prescriptions have become more common. So why did e-prescriptions replace handwritten prescriptions in the last couple of decades? E-prescriptions, or electronic prescribing, began about 2008. There are several benefits to e-prescriptions. It eliminates the dangers of illegible doctor writing. It reduces the risk of ambiguity with interpretation errors and supplying the wrong drug, as some drugs have very similar names. It automatically checks the drug interactions and allergies. There's faster processing. It combats fraud. And e-prescribing is supported by digital health platforms and telemedicine. So what are some of the reasons for drug prescription requirements? So the case for drug prescription requirements argues that it ensures that your condition or diagnosis is treated appropriately, that patients are protected from potential side effects, that misuse and dependency is avoided, that limiting access to antibiotics helps limit resistance to these antibiotics, and that healthcare is more personalized and facilitates patient follow-up. The bottom line is that the case for drug prescription requirements is mainly about ensuring patient protection and that medications are used correctly. However, with the advent of AI, many of these rules and legal requirements need revisiting and revision. Now let's also look at some consumer responsibilities with respect to prescription medications. So consumers have responsibilities also. You just can't rely on practitioners to give you safe and effective drugs. You also need to do your homework. A lot of drugs are costly, but there are plenty of online ways where you can find cheaper medications. Also, remember to take the medication as prescribed. I know some patients who found medications costly, so they would take them only once a day instead of 3 times a day or every second or third day. That means that most of the time you're not getting the desired effects of the medication. Also, don't take other people's medications. Although their conditions may seem similar to yours, their drug may not be appropriate for your condition. Also, study your drug online. Many medications don't have obvious side effects but can affect you in unusual ways. For example, some blood pressure medications can cause coughing, ankle swelling, or erection issues. Statins can make you feel like you have no sexual drive, and some antidepressant medications can inhibit or delay ejaculation. Also, some medications can just make you feel off or weird, so it's entirely appropriate for you to check with your practitioner to see if you can try something else. More importantly, you should also explore preventive measures to stop taking a costly drug. For example, if you're overweight and taking a blood pressure medication, try losing weight to see if you can normalize your blood pressure to stop taking the drug. Also, there are far too many people that are taking medications that don't need to be taking them, especially elderly people, and periodic reviews to determine whether the medication needs to continue is important. As well, we should mention blood tests. Sometimes blood tests are needed before a medication is prescribed, as the medications may affect blood levels, and at other times blood tests are required to monitor drug levels. Additionally, many pill containers will add an expiration date, such as discard after a certain date. To a large extent, however, these expiration dates are an exaggeration. Also, many medications have decades of proven safety data, and there's no reason why these medications can't be over the counter. Some generics have been proven safe for decades. Drugs such as oral contraceptives, EpiPens, statins for high cholesterol, certain asthma inhalers, and some topical antifungals and topical antibiotics. And this particular list has low potential for misuse. But there are many, many more drugs that have long safety records, and they should be added to the over-the-counter or OTC list. What about the claims against prescription requirements? Are the guardrails there to protect patients or mainly the business of healthcare? So are these claims about prescription requirements for routine drugs, labs, and imaging tests valid or somewhat hollow? The problem with these prescription requirements is that it limits patient autonomy and self-care options. It's inconvenient and inefficient for consumers. Also, it adds costs for consumers, and insurance and pharmaceutical businesses benefit from the self-serving laws and regulations to continue with the current system. On the other hand, AI-generated healthcare information is available on virtually every smartphone, and healthcare consumers can get a lot of details about medications, labs, and imaging tests this way to be fully informed. So the drug industry claims that prescription requirements protect patients. But what about the safety issues concerning imported generic medications? So today, some 90% of our pharmaceutical market is comprised of generics, and the majority of these are manufactured overseas, especially in India and China. Manufacturing plants in these places were found to be routinely falsifying test results, manipulating quality data, and using shadow labs to produce fake compliance reports. Many manufacturing plants had substandard facilities and poor production protocols. Some generics did not work properly and had incorrect dosages or failed to deliver the active ingredient effectively. Clearly, this situation is highly undesirable for important medications like cancer drugs, because incorrectly manufactured drugs may be totally ineffective. As well, whistleblowers were commonly ignored, and most surprising, there appears to be a virtual lack of quality control in the US once these generic drugs are imported from overseas. The book Bottle of Lies by Catherine Eban exposes this horrible business of generic drug manufacturing very well. The apparent lack of quality control of imported drugs in the US is in very urgent need of review and change. So why are imported generic medications a concern for healthcare consumers? Many of these imported generic drugs seem to lack quality control details and may be both impure and defective. Healthcare consumers can be wasting their time getting health insurance referrals for doctor's visits and then prescriptions for costly generics that could fail. Also, there may be unknown agents within these generic drugs, other than the correct molecule, because generics and medications in general have two basic ingredients: the active ingredient and inactive ingredients. The inactive ingredients include binders, coatings, colorings, flavorings, and preservatives. Each of these components can be responsible for an issue, side effect, or complication. Also, healthcare consumers are unable to check supply chain details, such as where the generics were made or whether they passed quality control mechanisms. And this abject failure of the American regulatory apparatus to protect unwitting consumers, and the lack of accountability with respect to the quality concerns of generic medications imported to the US, obviously leads to an erosion of trust. So we've looked at some of the prescription requirements for routine medications, but why are prescriptions still needed for routine labs and imaging studies? Again, we see claims made to support prescription needs for routine labs and imaging tests, similar to those made for supporting prescription requirements for drugs, that routine labs and imaging tests need clinical context, patients may overuse a certain test or schedule an inappropriate test, that you need rules and regulations, as well as getting an expert interpretation. Why prescriptions are still in place for many routine labs and imaging tests is due mainly to legacy regulations, old-fashioned medical gatekeepers, exaggerated liability and safety claims protecting healthcare revenue streams, all being dragged down by the inertia of policy evolution. But why is it that some states and countries allow better access for consumers to routine medications, labs, and imaging tests? So why is it that some states and countries have broad over-the-counter drug access, states such as California, Oregon, Washington, New Mexico, and Colorado, along with certain countries like New Zealand, Australia, and Britain? They also have increased pharmacist authority, decreased litigation risks, and have better cost controls. Yet, this variation in over-the-counter drug availability for different states and countries for the same medical condition underscores why we need greater over-the-counter access. What about access to routine labs and imaging tests? Why do some countries and states allow broader access? So let's look at consumer-directed labs and imaging testing. Several countries allow patient-directed labs and imaging tests. Self-referrals are allowed in several states for x-rays, ultrasounds, and DEXA scans. Several states allow some degree of direct access testing. Such access facilitates consumer privacy and control. No U.S. state outlaws the limiting of imaging self-referrals, but most imaging centers require a doctor's order or prescription due to insurance rules or radiologists' liability concerns. These issues could be easily resolved by having patients sign a waiver for consumer-directed testing. But medical conditions are not state or country specific. So why do we have this variation in healthcare laws? So there's plenty of doubt concerning the sincerity of the so-called protective measures of prescription requirements for routine drugs, labs, and imaging tests. particularly because medical conditions are not state or country specific. This business of prescription requirements also restricts patient autonomy, restricts consumer privacy and control, and it's inconvenient, inefficient, and costly. All of these guardrails and claims about prescriptions protecting patients and consumers needs to be revisited, especially in the age of AI-driven healthcare information, and because people are responsible for their own healthcare spending. Consumers should have much more autonomy and be able to decide what sort of medication they need and to decide what imaging and lab studies they feel they need. Many so-called protective guardrails appear to be more about keeping control of the healthcare consumer than ensuring the safety of the healthcare consumer. So how can we reform prescription policies for medications, labs, and imaging studies so that we have a smarter system that balances safety with accessibility? So it's bad enough that health plans have restrictive networks and tell you which doctor you can see and how many visits you can have, and then also restricting consumer-directed access to routine medications, labs, and imaging tests. These rules are burdensome, outdated, and in need of urgent review on both state and federal levels, especially in the age of AI or artificial intelligence-generated healthcare information. A modern healthcare system should strike a much better balance between protection and empowerment. We can reform prescription policies for drugs, labs, and imaging studies by expanding access to more over-the-counter drugs with proven safety records, empower other frontline providers like pharmacists, physician assistants, and nurse practitioners to write prescriptions, and streamline the FDA's prescription to over-the-counter switch process, especially as real-world alternatives already exist in various states and countries. But because of the quality concerns with imported generic drugs, we need much better quality controls within the US, and we need to review expiration dates for drugs. As well, reforming prescription requirements for routine drugs, labs, and imaging studies is easily supported by telemedicine and digital health marketplace platforms such as HEALTHdrum. These processes enable the delivery of affordable and convenient healthcare across state lines. So let's recap. In this video, why do you need prescriptions for medications? You learned that prescription requirements restrict patient autonomy. There are few health dangers with direct access to medications, labs, and imaging tests, and the whole business of prescription requirements is in need of urgent review and revision. To learn more about routine medical conditions, self-care, and digital health, check out some of these other videos.